is dry needling?
Dry needling is a subject that's been getting a lot of attention lately. This is a form of pain treatment that involves inserting a needle into a spot in a muscle called a trigger point. Trigger points are kind of spastic spots in a muscle that can refer pain to farther away parts of the body. And trigger points are responsible for a great deal of pain in many patients. The practice of dry needling was actually invented by a woman named Janet Travell, who, as a matter of fact, was the personal physician of John F. Kennedy. She created dry needling using a syringe, a medical syringe and a needle, and learned that by injecting a small amount of saline or some other kind of inert substance into a trigger point would help it. And gradually she began to do the same procedure without actually injecting any medicine, and therefore it became called dry needling. In recent times, physical therapists have begun using that same kind of technique, inserting a needle into a trigger point, and in general they use an acupuncture needle to do that, and it's a very helpful technique for many people. However, acupuncturists have become concerned because acupuncturists essentially do dry needling all the time. We insert needles in trigger points and other parts of the body, and we don't use any medicine in our needles, and we help people with pain. So there's been a large battle between physical therapists and acupuncturists in some states about whether or not physical therapists should be allowed to do what acupuncturists believe is essentially acupuncture. Another interesting feature of this is that in many places, health insurance will cover the cost of dry needling, but it won't cover the cost of acupuncture. So it's become a pretty heated debate in many areas, and it's being decided on a state-by-state basis. And the determination of this will be made down the road. But in our state just recently, it was determined that it was okay for the physical therapist to continue doing dry needling. Dry needling is not technically acupuncture in this state. So we will continue to see how this all pans out in the coming times.